Hello, my name is James Ross. I'm President and CEO for West Tennessee Healthcare. It's my honor to introduce to you today the Hope and Healing Foundation. It is our belief that creating an entity that is solely dedicated to addressing the healthcare initiatives in our community is very, very important as we focus our efforts on the well-being of our community in West Tennessee. The West Tennessee Healthcare Hope and Healing Foundation is proud to say that 100% of every dollar given will be used to support the health and well-being of our patients, our staff, and our community. The Hope and Healing Foundation is channeling our resources towards critical areas such as patient needs, employee assistance, education, mental health, and social determinants of health, especially as we continue our campaign towards building the region's first hospice home. The Hope and Healing Foundation is accepting donations and will be planning an upcoming event in early 2024. Please join me in celebrating and participating in the Hope and Healing Foundation.
My name is Sarah Smith, and I am a native of Jackson, Tennessee. I live here with my three girls, and in 2016, I was taking care of my father, and he had reached end of life. At that point, I was left with two decisions: either put him in a nursing home, which I did not want to do, or I could care for him at home, which I knew with young children that was not possible. So I was lost. I didn't know what to do, who to turn to, who to ask questions, and I was shocked that they were telling me at the hospital he needed hospice care. However, the only place to get that hospice care was in the hospital, home health, or a nursing home, which I knew at that time was not feasible. My father was still young, and a nursing home just did not seem like the place for him and for me to be coming to visit him at his end of life. And I knew that I wanted him at home. I wanted him in a home-like setting so that it was comfortable for me, for him, and for my children and his friends to come and visit and be with him at that time.
My name is Brad Little. I'm here today to talk about the need for a hospice home here in Jackson, not only to serve the citizens of Jackson, but all of the citizens of West Tennessee. There's not a hospice home facility outside of Memphis or Nashville, and it certainly is much needed. There are many families who do not want to see their loved ones pass away in a clinical setting, in a hospital setting, or even at home. Many homes certainly are just not conducive to that situation. So having a hospice home here in Jackson and to serve the families of West Tennessee is vital. I encourage you, if you're an individual citizen, if you're a business, to give to this campaign. Show your support by sponsoring and giving money to this much needed facility.
Hello, I'm Dr. Stephen Williams. I'm a hospitalist at Jackson General Hospital, and I'm here to talk to you about the Hope and Healing Foundation and why it's so important to our community. Over the past couple of years, I've been very fortunate to work with the doctors and other members of the community to build a hospice house here in Jackson. Over time, working in this hospital, I've dealt with many families that are struggling through very difficult points in their life. The hospice house giving people a place to go to be with their family and find peace at those difficult times. As a physician, I actively support the Hope and Healing Foundation. I hope that my other co-workers and physicians will also reach out and help the Hope and Healing Foundation through donations and time.
We're the Nairn family. My name is Nick Nairn. This is my wife, Erin Nairn, and this is Zimmy Nairn.
And we were fortunate enough to receive the amazing services from the Hope and Healing Foundation. Our daughter, Emmy, was born at 29 weeks. She was 2 pounds, 10 ounces, and we stayed here for 66 days. And I just cannot imagine what we would have done without the amazing care we received here. The Hope and Healing Foundation is a wonderful foundation to donate to because people like us really benefited from the the services provided here at the NICU was so good to us. It just felt like a warm hug, honestly.
Because of the services we received here at the NICU, she is now a thriving, energetic, glowing 2-year-old, and we couldn't be more thankful. So it's very important to help support and donate families like ourselves for the Hope and Healing Foundation.
Cardiovascular disease is the leading cause of death in West Tennesseans. You partnering with the Hope and Healing Foundation right here in West Tennessee helps us raise the funds that we need to fight the cardiovascular disease. Please consider donating today so that if you or your loved one are affected by cardiovascular disease, you receive the high quality care that you deserve.
Hi, I'm Karen Ellis, the Executive Director for the Alice and Carl Kirkland Cancer Center. Your donations to Hope and Healing ensure that KCC patients receive the treatments that they need and the access to with transportation assistance and other necessities that you and I take for granted. Thank you, and we appreciate your continued support.
We're excited about the Hope and Healing Foundation, where one of the funds goes directly to Kirkland Cancer Center, and it helps our patients have to worry about one less thing.
I'm Donna Steins, the Philanthropy Director here at West Tennessee Healthcare. Thank you to all of you for being our donors and supporters over the years at West Tennessee Healthcare. We appreciate you being here. As you have seen, the need is great for specialty healthcare in West Tennessee. We have a great opportunity to change generations. Partner with West Tennessee Healthcare and the Hope and Healing Foundation to ensure there is quality care you trust right here, right when you or your loved one needs it. We must take care of our community. I need your support. We need your support. Please work with me. Healthcare is where you can invest your dollar. You're either changing someone's life or you're saving it. And every dollar you invest with 100% goes to help our patients and families, and we must take care of them.